Hello everyone, welcome to my channel once again. The channel name remains the same, the Nursing Student Channel, your favorite YouTube channel that deals with all nursing knowledge and education. If you are new, don't forget to hit the subscribe button and also hit that notification bell so that you get every new video that comes on the channel. So now let's go on to today's topic, and that is formulating diagnostic statements under the diagnostic process that we started in the last video. So when it comes to formulating of diagnostic statements, we have to define what a nursing diagnosis statement actually is, and the definition is that it describes the health status of the individual and the factors that have contributed to that particular health status. So the nursing diagnostic statement, as it says, is a statement that describes the health status of an individual and then the factors that have contributed to that particular health status. Okay, so that is basically the nursing diagnostic statement. And like I said, we have types of the diagnostic statement. We have the one-part diagnostic statement, we have the two-part diagnostic statement, and then we have the three-part diagnostic statement. I won't go into details for the three-part diagnostic statement because we did that already. In the nursing diagnosis chapter 2, we did that. That is what we use to explain our diagnosis. Okay, so we're not going to do the three-part diagnostic statement anymore. We're just going to focus on the two-part diagnostic statement and then the one-part diagnostic statement. Like we said in that video, the two-part diagnostic statement is basically meant for risk problems, okay? Risk or potential problems. But then most often we also use it for health promotion problems. So just like the three-part diagnostic statement that we have the problem, the etiology, and then the defining characteristics, the two-part diagnostic problem, because it's a risk or potential problem, does not have a cause. But then it has a problem which we call here as a diagnostic label. The diagnostic label here stands for the problem. And then the second part is the validation for a risk. Okay, so the validation for the risk diagnosis is also known as the risk factors that may cause the problem. Risk factors or potential or predisposing factors are just like causes of a condition or of a problem, just that because the problem hasn't occurred yet, we can't say that it is a cause, but then we say it is a risk factor or a predisposing factor or something that which happens can expose the patient or the individual to experiencing that risk. All right, so in this two-part diagnostic statement of risk and potential problems, we don't have a problem, etiology, and a defining characteristic. That's a PES or PAS. But rather we have the diagnostic label, which is the P, and then instead of the relating factor that is the cause, we rather have here the validation for a risk, okay, which is the same as the risk factors. And the main difference between the risk factor diagnosis, and that's the two-part diagnosis, and the three-part diagnosis, is that with the two-part, we don't use related to conjugate the two different statements, but rather we use as evidenced by. So you can say that risk for falls related to, are you getting it? We can say that risk for falls related to improper use of crutches, but rather we can say that risk for falls as evidenced by improper use of crutches. We are saying that this patient can fall because he's not using his crutches well, but not that this patient has fallen because he did not use his crutches well, because it has not occurred yet. For all you know, he might not be using his crutches well, but he will not fall. Okay, so we don't use related to, but then we use as evidenced by. So we have risk for falls as evidenced by patient not using his crutches well or improper use of crutches. But we don't say risk for falls related to improper use of crutches. Note that. Never use related to conjugate a risk diagnostic statement or a two-part statement, if only it is a risk problem. And even when it's a health promotion problem and you want to do it, you want to say readiness for enhanced coping. You can't say related to. Do you get it? But then you have to see as evidence by, because what are we seeing to show that the patient is ready to cope? Or what are we seeing to show that the patient is ready to learn? So if we are saying something, then it means it has to be an evidence of what we are saying. The same applies to the risk. If we are saying something, then that has to be an evidence to why we think that a patient is at risk. So once you make it related to, then you make it something like a constant, which means whether it happens or not, it is related to that. But then the patient might fall, not because he didn't use his crutches well, but because there was water on the floor. I get it. So the risk diagnosis is like a possibility, just as the problem is, there's a possibility that the problem can occur. So there has to be a possibility that the cause or what the risk factors is what will cause it. Okay, so it's not a constant that the risk factor will cause it. So we can use related to. That is the main difference. And again, don't forget that because the risk factors or potential problems are not existing problems, you cannot have signs and symptoms for them. Do you get it? So you can't have defining characteristics for risk diagnosis or two-part diagnostic statements. That is why we replace the causes, that's the related to factor, by the as evidence by. But then we don't have an as evidence by as defining characteristics, okay? Because it's only when the problem exists that you have characteristics or signs and symptoms. But if it doesn't exist, then you have risk factors, which becomes the as evidence by, but then doesn't make them the defining characteristics. Are you getting it? Good. So for example, we can have risk for infection as evidenced by compromised host defenses. So the compromised host defenses is likely to make the patient get an infection, but it doesn't mean that the patient has an infection. And the patient can also go through that process without having an infection. And the patient can get an infection not as a result of the compromised immunity, but then as a result of something else. You get it? That is what makes the two-part diagnostic statement a little bit complicated. And then we can also have risk for injury as evidenced by abnormal blood profile. But that doesn't mean that it's only abnormal blood profile that can cause an injury. You can get an injury from any other source. Okay, that is why we don't make the risk factors constants, like related to factors. Now let's go to the one-part diagnostic statement. It is very simple, not a long talk. We're not going to talk long about it. The one-part diagnostic statement basically deals with all the rest. So possible diagnosis, cluster, whatever. And the one-part statement is basically just the problem. So with the one part, we just have the solution to the problem. That is, for example, we can have readiness for enhanced breastfeeding, and then that is all. So it usually starts with the readiness kind of statements, all right? And then, for example, if we have a syndrome statement, we can have RIP trauma syndrome, accident trauma syndrome, assault trauma syndrome, okay? So that is basically the one part statement. It's not much. We don't normally use the one-part statement. Normally, the ones that we use are the two-part diagnostic statements and the three-part. And usually, we use the three-part because we always deal with actual problems first before we go to potential problems. And now let us move on to the variations. The variations in the diagnostic statement basically are just exemptions, okay? Situations that you can bend the rules just a little bit, you can change things, and then you can also add things to spice up your diagnostic statement. So the first exemption or the first variation that we're going to talk about is that when dealing with three-part nursing diagnostic statements, we have the modifier or the qualifier and then the problem focus for the problem. That's the P. Never use modifiers or qualifiers for one-word nursing diagnosis. For example, anxiety. You can't say impaired anxiety or altered anxiety. Alright? For constipation, you can't say impaired constipation. For, let's say, diarrhea, nausea, you can't say impaired, you can use altered, you can use inefficient, you can use... No. You don't use qualifiers for one-word nursing diagnosis. And examples of the one-word nursing diagnosis are what I have given. Anxiety, constipation, diarrhea, nausea, and those kind of things. And then for the second exemption, always understand that risk diagnosis uses as evidence by instead of related to conjugate the two different statements. And risk diagnoses do not have an etiology or cause, but then they have a risk factors. Always bear that in mind. They do not have etiology or cause, but they have risk factors. Thank you. And then the next one is when you want to specify. Okay, when you want to specify a particular problem. For example, we have impaired skin integrity. So if you have impaired skin integrity, which part of the skin is impaired? Okay, we have the skin can be from the scalp to the sole of your feet. So which part of the skin, which part of the body is impaired right now? Then you have to specify which part, and in specifying that part, you have to bring the specification into brackets. Okay, so right after your problem, then you bring the specific area or the specification that we want to make into brackets. So for example, impaired skin integrity, and that skin part that we're talking about is, let's say, the right chest. So impaired skin integrity, and then you bring into bracket the right chest, related to, let's say, tissue disruption or disruption of skin surface, as evidenced by, you get it? Then you bring your evidence, and that evidence by could be patient verbalizing that I have sore on my chest or any other thing like that. So in specifications, you always bring the specific area or the specific thing that you want to talk about into brackets right after your problem. Okay, right after your problem. And then when you have an unknown etiology, when you want to use an unknown etiology, we use an unknown etiology when you don't have any knowledge on the cause, the contributing factor, the risk factor, or whatever that causes the problem. So in a three-part statement, if we have a cause that we don't know of, then we use unknown etiology. So the statement can be, let's say, ineffective coping related to unknown etiology. Or like the example that we use example of possible social isolation related to unknown etiology. So that is for when you want to use unknown etiology, or when you don't have a specific or known knowledge about a risk or an etiology or a cause of a situation. Then the next one that we're going to talk about is, what if it is different factors contributing to the situation? For that one, you're going to use complex factors but not unknown etiology. If we know the factors but then there are too many for us to state them one after the other, then we are going to use complex factors to classify all of them. So for example, we can have chronic low self-esteem related to complex factors, as evidenced by patients not talking to people or patient always alone. So we have chronic low self-esteem related to complex factors. That means the factors that is causing the patient's low self-esteem are so many. It can be family factors, it can be personal factors, physical, psychological factors. So we can't state all of them. So we just classify all of them with complex factors. And then the last one, when you have about two causes to one problem, in a 3 parts, or whether a 2 part or 3 parts, when the causes are 2 or more than 1, you can't say, let's say, let's use this example, risk for decreased cardiac output related to reduced preload related to myocardial infarction. No, you can't use that. So which one is getting related to which one right now? Okay, but then you can use, in that case, you're supposed to use the word secondary to conjugate the next cause. So the first one is going to be risk for decreased cardiac output related to reduced preload. And then when you want to add the second cause, you use secondary to myocardial infarction. So all that this statement means is that we have a risk of the patient having reduced cardiac output because this is where we're talking about the actual cause to it, that is reduced preload. And what is causing the reduced preload? The reduced preload is being caused by the myocardial infarction. So the myocardial infarction is not a clinical manifestation or a defining characteristic to be conjugated with as evidenced by, but rather it is also a cause to the reduced preload. But then we can't say that risk of decreased cardiac output related to reduced preload related to no. It is wrong. So we have to use a word that will conjugate the next cause to the first cause, and that statement is the secondary to. So whoever picks your nursing diagnosis is going to understand that the patient has a risk for cardiac output, or it can even be an actual problem. The patient has a risk for decreased cardiac output because he has reduced preload, and that reduced preload is also caused by myocardial infarction. Are you getting it? So the next cause is not also conjugated with related to, but rather secondary to. So that brings us to the end of today's lesson. I hope you learned something. I hope you had some knowledge. I hope you had some explanation on something that you've seen or heard before that you weren't understanding. To close the class, I would leave a situation here. It will be the question for the day. Take your time, go through it, answer it all, and then the next video you share your answers, or you can even share your answers right here in the comment section, so that anybody else that solves it can get your answers to use to check theirs and see how good they are going with it. So the question comes next. All right, so we are done. Have a nice day, stay safe, keep learning, and always have a nice life. Bye bye.